helping me out and reporting things to me. This is just to keep us mindful of keeping our residents turned, making sure, phony promises are being protected. Alright, so I'm going to ask a few questions, and I got a little incentives. So, alright, does anyone know what the largest organ of the body is?
The skin.
Who said that?
Skin.
Oh, girl. It's the skin. You wouldn't think so, but the skin covers the whole body and protects all the internal organs, just like our armor. It protects the body, regulates body temperature, and facilitates sensation of touch. Alright, so why do we need to be concerned about proper positioning? To decrease problems with skin breakdown. It hurts if you're not in the proper position. Have y'all ever slept on a rotten mattress or in the wrong position, woke up with a crick in your neck? Body alignment's not right. So the residents that can't tell us don't know, to let us know that they need to be turned and it hurts. So how do we minimize skin breakdown of our residents? We need to make sure their circulation is not being cut off. We need to rotate and position them correctly with no wrinkles in the sheets or pads. Of course, there's other risk factors that contribute to a resident developing a pressure ulcer, and I kind of was going to ask the nurses about this, but do y'all know any other contributing factors?
Diet. Poor
Nutrition, prolonged immobility, if they have neuropathy, where diabetics can't feel sensation of touch, urine and bowel incontinence, shearing forces like transfer wars, and then those with diabetes. So I've passed out some papers, but we're looking at different positions while in bed. And not a lot of our residents are in prone position, which is on your stomach, but I think there is one that I know of that likes to lay on his stomach. But so in supine position, which is on your back, we always want to place a pillow under the head and shoulders and under the knees. It says put sandbags, but any kind of wedge or other pillow to keep the hips and maintain alignment. And then place any kind of splints or hand rolls that are needed for the patient to prevent contractures. If they're sidelined, you want the upper leg bent and flexed. Place pillows under the thigh, leg, and foot for support. Place a pillow under the head or neck, and then tuck a pillow behind the back or a wedge. And then prone position, really just need to make sure their toes are off the foot of the bed and not on the mattress itself to prevent pressure ulcers. And make sure their face is turned to one side, and always make sure they're rotating. Okay, so we've got other devices, the splints for hands, the multi-folded splints and wedges, and then there's specific medical needs, decubitus ulcers, respiratory problems, swallowing disorders, and feeding tubes. Alright, next question. Who knows what the head of the bed needs to be if they had any of those problems, respiratory problems?
45 degrees.
45 degrees. Head of bed needs to be below 45 degrees, and that'll decrease the risk of sliding down as well, but also for tube eaters, so they don't aspirate.
I get it, because she gave my answer.
Okay.
Yeah.
And then
Markina was just
Sharon
about to
is
say
one,
it.
too. Okay, so what are the pressure points for someone lying in bed? What are some pressure areas? Heels.
Back of the leg, up on the elbows.
Right. Scapula. We have one resident that's got some problems with their ears, so we always have to make sure that we keep them turned. Bed down patients should change positions a minimum of every 2 hours. And then we've got our turn schedule. I know it's hard to remember this at times because we have to put it in the closet, but it's just a dignity issue. But these remain in the closet. But it's designed for the 12 and 6 times for them to be on their back so that they can eat at their meal times. Alright. Okay, now we're going to look at someone sitting in the chair. And we have a lot of residents that get up during the day in their wheelchairs. We want to make sure they have proper alignment. The devices that they need to keep them in proper alignment, the wedge cushion, mat tray, footrest, cushions for the chair. And then for these residents, for those that can tell us, we always need to, or for those that can be educated, remind them to try to shift their body weight at least every 15 minutes. So even if it's just like kind of lift your honey up and just, relieving pressure every 15 minutes if they can. If they can't be educated, we're responsible for them. We need to at least move them every hour. And that's lifting them up, changing body positions, and putting them back down. The pressure that is placed on the body structures of your hips is increased by 30 times. So where are some pressure points while you're sitting in the chair? Coccyx area, for those that are in the Broda chairs and that are kind of laid back, the back of their heads. Scapula, shoulders, coccyx, tailbone, behind the knees, behind the calves if they have cushions back there, and then on their feet as well. So, let's see. Yeah. Okay, and then, let's see. How to report a problem. There is a book on each unit for wound notifications. If I'm not here at night or this the weekend and I'm not here, anytime you see an area, there's a form in here, just fill it out, and there's a box on each unit with my name on it. If it's an acute injury, like a skin tear, something that needs to be addressed right then, the nurses are responsible for that. Okay, and then I have some true-false questions. These are pretty easy, but patients should not be repositioned during the night because you might wake them. False. If you don't know how to put on a positioning device on a patient, you should just leave it off.
False.
Following schedules for repositioning patients is not very important.
False.
Proper bed positioning is important to help prevent skin breakdown.
True.
To offload the heels, it is recommended that a pillow be placed lengthwise from the knees to the ankles. True. And do y'all know what that's, that's basically just called floating the heels. Yeah, just make sure there's air underneath it and not touching the neck. Sound good? Just reminders, y'all do such a great job, but we y'all need to be reminded every once in a while. Y'all can take as much as you need.